I'm Nikki Mihalopoulos, and I get to introduce the next set of speakers. The first speaker for this section is Dr. Annie Isabel Fukushima, who is the Associate Dean for Undergraduate Studies and Director of the Office of Undergraduate Research. She is also an Associate Professor of Ethnic Studies in the School for Cultural and Social Transformation. Dr. Fukushima is the author of the award-winning book, Migrant Crossings, Witnessing Human Trafficking in the U.S., the principal investigator for the Gender-Based Violence Consortium, and a member of the board of directors for the Utah Coalition Against Domestic Violence. And she is going to talk about social theory of need from the margins.
Well, thank you for having me. What a set of speakers we've been listening to. It's been really exciting. And thank you all for hanging out with us during this afternoon. And thank you for the introduction. I'm just going to go ahead and get started because I believe I have 15 minutes. Is that correct? I have 15 minutes to get going. And as you can imagine, this project's actually informed by my work, my previous research, but actually research has been going on since 2018. So just a quick overview is that I'll provide a quick overview of gender-based violence. I'm not going to really get into the details because I'm going to trust that this group is the kind of group that knows quite a bit about it. I'm going to go into the reasons why I'm doing this research, thinking about a social theory of needs. And then I'm going to talk about my methods. I'm going to describe a social theory of needs, and then some of examples, and then just very brief concluding reflections. And so thank you, folks. So just very briefly, gender-based violence is an umbrella term to describe multiple forms of harm directed against women, girls, and gender minorities, where the violence is enacted to maintain gender inequalities. Gender is a complex and multi-level cultural construct structured by intersecting identities. And so then that makes us think about then, well, what are the types of gender-based violence that happens? Well, what we know is it happens in a range of forms, from intimate partner violence, sexual assault, dating violence, forced marriage, hate crime, stalking, abuse, and human trafficking. And so gender-based violence cuts across many forms of violence. And oftentimes what we know is polyvictimization also occurs, where one person may be experiencing multiple forms of violence across their lifetime. I'm also central to my work is thinking about intersectionality. And so what we know about intersectionality is that we cannot delink our categories in the ways that we understand dynamics of gender from other forms of identities and forms of oppression. And so here, when we think about gender-based violence, it oftentimes intersects with the way that we understand LGBTQIA, the Black experience, Indigenous, Native American, people of color, immigrant, and people living with disabilities, just to name some of our intersecting identities. Here, Jill says, survivors who live at the intersections of all these identities often experience compounded instances and impacts of violence. Race is particularly salient because race, when combined with other marginalized identities, gender, sexuality, immigration, status, almost always becomes a primary determinant of disparity. Intersectionality can be used to research and understand the roots of violence, the barriers and resiliencies to seeking help from violence and social responses to preventing violence and provide safety nets for survivors. And so one of the things I do want to preface that I won't get to go into a lot of detail about, but whenever I think about concepts of gender-based violence, I cannot delink it from resistance. Where there is oppression, there is always resistance. And so someone is resisting violence against them in all contexts, right? We are not passive victims, even in our silence. And so today's conceptualization of a social theory of needs is very much shaped by my own thinking and research since 2018. I have been conducting statewide needs assessment, city needs assessment since 2018, working with coalitions and organizations across the country. And that one of the things that is just to kind of preface is that my research and thinking about needs has shifted because it started in 2018 pre-pandemic, and then I continued to do the research during the pandemic, and now we are supposedly out of the pandemic. And so that's just to give you a little bit of the context. But as I was thinking about needs, one of the things that just kind of reflecting on the context of needs is that I was very much struck by our own realities of thinking about how we understood needs during crisis. And so just to give you a little bit of situating of my research is that I've done observations in 10 different cities, 8 different states. I've conducted quantitative data where I've surveyed 2,000 people, and I've conducted qualitative data of interviews and focus groups where I've spoken with 134 people since 2018. And so in this now probably 10 minutes, you will only get a very sliver of that larger project that will be the next book project. And so just to give you just a little bit of overview of the participants, and this is actually for Utah, not just Salt Lake City. The average years of expertise of folks that I spoke with had about 9.5 years of expertise on the issues, 9.5 years to 11 years. They were more likely to be female identifying, heterosexual, with representation of LGBTQA, as well as people living with a disability. And they came from a range of professional backgrounds. The needs assessments that I also conducted in San Francisco, they also were just as dynamic, with an average years of expertise being about 5.5 years, also more likely to be female, heterosexual, LGBTQA, and living with a disability, 11% living with a disability. And so if you're interested in the states that I have visited and the cities I have visited, here they are from Maryland, Texas, California, Louisiana, New York, South Dakota, and North Carolina. But you're probably more interested in the theory of the social theory of needs. But before we can get into that, just to kind of preface, a needs assessment, oftentimes many of us are familiar with this. They are oftentimes, many cities and states will do needs assessments because it helps them to determine how they prioritize their resources. And so we oftentimes will see it as a way to address needs, but it's also a way to ascertain who gets to have resources. And so overall, it is a collection of data that will inform services, products, or information. So to think about a social theory of needs, one of the things I just want to start with is social structures affect people and their behavior. And we've already been hearing about this quite a bit actually today. And so we're seeing the intersections of the social relations. One of the very common, which I'm going to critique afterwards, is Maslow's hierarchy of needs. We're very familiar with Maslow's hierarchy of needs, where it is oftentimes assumed that we are moving from, it's a theory about motivation, and the assumption is that once a need has been satisfied, you go up the hierarchy, and then you'll get to the next level of need. And that the lower 4 tiers oftentimes helps us to think about deficiency, and that the top tier is a growth need, right? So the highest point is self-actualization. But some of the things that I think is that actually, can we be self-actualized even when we are not having our needs met? Can we? And I think, of course, why not? And so questions that arise in responding and thinking about crisis is, how do our social conditions shape what we think and believe is a need, shape and impact what we believe others need or what we think they do not need? How might we understand the slipperiness of needs and desires, and then also how it moves across various scales? And so those are some of the things that I'm thinking quite a bit with, that I'm happy to think about with you all in a coffee hour or afterwards. But when I did these needs assessments and I've been talking with people, some of the things that have been coming up quite a bit in conversations as primacy of needs, and not saying this is the only need, is that they were oftentimes not just focusing on a particular type of area of need, like physiological or safety or love and belonging. Oftentimes people were talking about and expressing that they had various needs that were cutting across, from needing family support, mental health, and housing. And as we all know, we are in a moment in which we are seeing across the country a housing crisis. And so in critiquing Maslow's hierarchy of needs, one of the things that I think is important to situate is how it cannot be delinked from the multiple spaces of individual, community, and the colonial state. And so when I'm thinking about these various needs that people oftentimes are expressing or motivated by, is we cannot delink it from these contexts, that when I think about an individual's need, we cannot separate it from the pressures of the community need as well as the state's need, and how it's oftentimes moving back and forth, shaping the ways that we experience the world. And I'll give you some examples to think about how, when we think about need in this complex way, how we might actually, and this, I'm calling it social theory of needs from the margins, because if we look to those who are experiencing crisis and experiencing violence in their everyday lives, we can understand actually in a more complex way how we understand needs. So just to give you some examples here of the community perceptions around needs, in San Francisco, if you look here, and I know it's a little small, but what the perception at the time of 2018 is that, you know, most people actually in San Francisco at the time of 2018 believed that domestic violence, human trafficking, and sexual violence occurred. So this is the opposite, right? So only 7% believed it did not, domestic violence does not occur. Only 10% believed that human trafficking never occurred, and only 17% believed that sexual violence does not occur very often. And so on the flip side, they believed that it is occurring. And here from a crisis line worker, she said, I think there's been a shift in people. I think people are talking about domestic violence more now than they were 5 years ago. I've only been here a few years, but what I was doing this in LA, and there was this difference between women calling in and having an idea of what they were going through then and really confused by it, then people calling in now and saying, it is 2017, why are these things happening? And so when we start to see that at the societal level, at the community level, and at the state level, there is more knowledge and a stronger perception that this is happening, that it does actually scale down into the local level. And then in a couple years later, I started interviewing people in Utah, and actually the perceptions were quite different here for us in Utah. And so we cannot delink where we live and reside from our context. And so actually 42% of those that I interviewed surveyed believe that domestic violence does not occur very often, and 46 of nearly half believed human trafficking never occurs, and that 40% believe that sexual violence does not occur very often, which, if you know the rates, it's actually occurring quite. We are more likely to know somebody who experienced violence in our lives than we are not. And so here a nurse says, the culture leads to victim blaming. Quite honestly, I think that survivors oftentimes feel a lot of self-blame, which then can go into feelings of shame, which really we know mental health wise, but those feelings of shame affect people so negatively. Utah culture also is less likely to believe survivors when they come forward. When we look back historically at rape laws or domestic violence laws, they stem back to times when women were seen as property. And because they were seen as property, that led to those first rape laws really being that they had to actively resist. We still see that bleeding through in our culture. And this happened, I was speaking with this nurse during the pandemic. And so as I'm thinking about a theory of social theory of needs, other concepts of security are coming up. And I just want to do a quick time check. 5 minutes? Do I have about 5 minutes? Who's?
Yeah.
5? Oh yeah, 5. Okay, yeah. So I'll get through it just generally, but some of the things that I've been thinking a ton about is safety, and I'm not going to really talk a ton about this. So as you can tell, I'm an over preparer and then too much content. And so one of the things I wanted to, so I'm going to just move through this very quickly. So I'm going to just reflect on an example of New Orleans. So I was in New Orleans and I was there to observe organizations that were assisting folks with accessing housing. So people who were trying to access housing in the area. As I arrive and I'm going to the meeting to meet with community organizations, I'm in an Uber, and my Uber driver is telling me about how at the time they had a hotel that had collapsed because of the heavy rains, and it's raining as we are making our way. So it's raining a ton, a hotel has collapsed, and she says that what had happened is that immigrants were working in there, but many of them had been undocumented. And because they were undocumented, they did not bother to retrieve the bodies at the time, and they just covered it with a tarp. And so here she's telling us this story about immigrants. This context is flooding and raining. the building had collapsed. I arrived to the organization to talk with folks about supporting survivors of human trafficking around housing access. And as I'm arriving, many are arriving late. Many are not able to arrive because it's flooding where they live and they're not able to actually physically get there. And so some of the things that I was thinking about in this kind of context, from the micro to the macro context of needs, is here we are here talking about housing access, but we cannot delink it from other aspects of others people's realities around the different ways that they experience security, love, belonging, and all of that, that all of it is interacting at the same time in this moment as I'm moving from the driver to having conversations with people throughout the day. And so I'm just reflecting on all of these things around needs and the complexity of needs. And that's just to give you a little bit of a sliver of the things that I've been doing, is observing, having conversations with people about a wide range of needs. What we know for survivors of violence is that everything's a need. They have many needs, from safety, from housing, and so forth. But as I think about housing in our own context, and just using housing as an example, is that what we know is that here, that renters with extremely low incomes face the biggest challenges of finding affordable housing, right? And so we know that even in our own context, housing is a concern. And this is just using housing as an example. I won't go into this in further detail, but I'm happy to have a conversation with you later if folks are interested. But one of the things I've been thinking also a ton about, though, is also then, as we think about housing access, using that as an example, I think about the examples of our context of Utah then. And we cannot delink it from our colonial context in which we are all residing on Indigenous lands, the Ute, Paiute, Goshute, Shoshone, and Dene people's lands. And so as we move forward in thinking about a social theory of needs, we cannot decontextualize it from our own context. And some of the things that, as I was having a conversation with folks who are working in tribal communities, they were talking about the distances that when people want to leave their abusive conditions, that it's so far from them to get to services, and that many of them actually wanted to stay in their communities because if they left, what is later described in a quote here is that actually for some of them, they believed it was more dangerous to leave, that they were more likely to experience other forms of abuse because of the violence against Native peoples. And so I know it's a lot to kind of think about, and you just had coffee and snacks, and we just were talking about the onslaught of the physical environments that are shaping our realities of the Salt Lake. But I do want to just say in brevity to move forward in conversation is that I hope that as we think forward and have these conversations around thinking about needs, what our needs are in our communities, that this framework that I'm theorizing is actually, it's to kind of move us away from the fact that many of us oftentimes are positioned from thinking about our individual needs, and we cannot separate that what's happening in our communities, and that there is actually communities who have a collective responsibility to needs, and that we might even consider being a part of that journey. And so I'm going to wrap it up there because that's a ton. And I hope folks will have conversations with me. I did put up here, if you're interested in, because I had promised folks that they would learn about gender-based violence in Utah. And so if you do want to learn about gender-based violence in Utah, you can visit the gbvc.utah.edu. And that one of the things you also might be able to read, to plug our Utah Women's Health Review, is we also published a statewide needs assessment around the state of gender-based violence here in Utah. So if you're interested in learning more specifically about what we learned from having conversations with people in Utah, you can read that report. So thank you for inviting me to be part of this conversation, and I look forward to more conversations with folks. Thank you.